So thank you so much for the kind introduction, Catherine. It's an honor to be here today, and thank you for letting me join virtually. Did not want to share our respiratory infections with anyone in the audience. If I do go on mute for a few seconds, it's just so I don't have to alert you all with a cough, but so excuse that in advance. So our session today is on drug repurposing, and I am excited to be sharing. If I can advance here, perfect. This session with four amazing speakers and collaborators. Clement Chow from University of Utah, Christopher Lee Messer from Stanford University, Amber Freed from SLC 6A1 Connect, and Zach Greenspan from Weill Cornell Medicine. I'll introduce the titles of their talks or the topics of their talks towards the end of my session or my presentation. So I'm going to be discussing our plans for drug repurposing and our program to accelerate treatments for Syngap-related disorder therapeutics. So traditional drug development takes a lot of time and a lot of money. Hopefully you can see my cursor here. There are multiple stages for drug development that we're all aware of and are working through. Drug discovery takes multiple years, preclinical research, less time, clinical research, probably the longest burden there, FDA review, and then marketing. And this is approval for drug label approval for one specific condition. If we look at our precision medicine pipeline, we can see that most of the gene therapies or the genetic treatments that we're looking at, the ASOs, the AAV-based reagents, and the cell-based treatments are in a preclinical or discovery phase. That means that there is still a length of time in order for these to be marketed and manufactured. They will be going into clinical trials in the near future, but it does not mean that they're going to be marketed and available for use for quite some time. So that leaves us with wanting to be able to provide some therapeutic relief to our families in the near term. So for this, we look for an approach called drug repurposing. We want to look for marketed and manufactured drugs that are FDA approved on the shelf and could be used for some treatment relief now. So our drug repurposing is the process of identifying new therapeutic uses for existing drugs that have already been approved for one condition, and we want to write prescriptions for those for off-label use for Syngap-related disorder. This accelerates the timeline of drug development because it leverages the preclinical pharmacokinetic and safety data that was amassed during the early stages of the traditional drug development pipeline. In doing so, this reduces the cost and lowers the risk of moving these drugs forward. And this is a primary focus for rare diseases, where it is beneficial that we look for other products that are available, because sometimes the logistics of clinical trials are very challenging for our conditions. We are rare. It is difficult to get a clinical trial up and running sometimes. And there are also regulatory pathways that are expedited that we can access to move this process forward. So for SRF's approach, we are framing this in my slides here as a fast approach to drug repurposing. And it's a four-stage approach that we're considering here. So, our first stage is finding new drugs, and I'm going to be focusing primarily on that today, just to introduce the speakers and set our stage for the talks to come. So in our find stage, we really want to evaluate different ways to do high throughput screens, to take the large amount of FDA approved compounds, these are just estimated numbers here, but large amount of FDA compounds that can be used for a single high throughput screen, and reduce those to some that may be effective towards a specific endpoint. And I'll talk about that in a minute. We want to review the literature for those to make sure that the drugs that are selected have a reasonable safety profile. We want to know what the other indications are, and we want to know kind of what type of mechanism that the drugs are working with. In our second stage, we want to assess those. I believe you heard about some preclinical work previously today in testing the drug effect in an in vitro model in a preclinical setting. We want to be able to have some understanding within a Syngap model of what type of effect this drug would have. Moving on to our third stage, then, it's kind of a soft movement into use in humans. Instead of going into a full clinical trial stage, which is very expensive, Our hopes are to gather real-world evidence through community-based observational studies in a survey stage. So once we have drugs that we know may be potentially therapeutic, we want to be able to gather information from families that are interested in taking those. That information will provide us with understanding of whether or not that drug may have benefit for the larger community, and if we can move that into a clinical trial phase, stage 4, our trial phase. So this would be hopefully in a decentralized clinical trial approach with a partnering physician. I'll talk about that a little bit more. So for each of these 4 stages, we are filtering through onto the next stage through a series of advisors and different partners within the field. So once we have drug hits, we want to talk with our scientists and advisors about which drugs would be reasonable once we kind of have that literature amassed and understand what types of drugs we're looking at. Once we have some preclinical data, we want to talk with our families and individual physicians to determine whether or not those are drugs that people would be interested in trying for their child's condition. And once we have amassed data through community-based observational studies, we want to work with families and lead physicians or industry and FDA to move that forward into a clinical trial phase. So the information that we would collect from these stages would be a building report from our find and assess stage. This report would gather all of the information on how this drug was identified, what it looks like in a preclinical model, and this would inform families and clinicians of potential drugs of interest that they might want to pursue for therapeutic use. Once we have some observational study data, the expanded report with this data could support off-label prescription coverage for a larger setting. If the drug is available to the community and it's effective, we may not need to go into a clinical trial phase. But if we do, then this evidence from our survey phase would be supportive evidence for moving into a clinical trial. So this final report would hopefully support an FDA label expansion and inform standard of care for Syngap-related disorder. So a little bit about where the drugs are from our repurposing approach now. We're going to be talking about these 3 drugs for the advancing drug candidates: Ravicti, Nel, Aqneursa, and nortriptyline. These were all demonstrated or shown in our last conference last year. So there were talks on each of these. It did create a lot of interest in the community, and we have moved forward into the community-based observational studies or the trial phase for these. And those are the talks that you're going to be hearing today. Other drug candidate discovery approaches are shown here, and I'm going to talk about those in more detail now. Our drug repurposing will be discussed in greater detail tomorrow at Family Day for any of the families that want to join and learn more about what we're doing and how you can get involved. So this goes through our find stage. We have got 3 approaches that we have pursued and funded for high throughput screening, and that includes these first 3, which is the phenotype rescue, in which selected drugs restore a healthy phenotype in a Syngap-affected clinical model. And the model that we've used for this is a Syngap-related disorder variant, the RASCAL-I mutation, which is an I phenotype in fruit flies. And the hope is that a drug would restore a healthy phenotype, and that improvements in this pathway would eliminate a dysfunction that's caused by this variant. Another approach is Syngap upregulation, and the identification of this was demonstrated at last year's conference as well, where selected drugs upregulate Syngap expression, and where the model that we're using for this is iPSCs, human iPSCs, and looking at an output of increased Syngap expression. And the hope would be that the expected response would be an upregulation of the Syngap gene, and the types of responses that we would observe with that are still unclear. The transcriptome restoration is another talk that you'll be hearing about today, in which selected drugs shift the human Syngap-related disorder patient transcriptomic profile towards a healthy profile, which is just demonstrated pictorially here. And this correction in the global gene expression would potentially improve the outcomes or condition for our family members. An additional approach that we're evaluating is rational drug selection. Selected drugs identified through AI modeling, pathway targeting, or common use. So one common use pathway that we are are going to be hearing about today is a bridge over from another neurological condition. So if there are other conditions that are similar to ours and there are drugs that are effective for that condition, we want to be able to evaluate that further. And depending on the drug type, the effects of this may vary. So I'm going to use this as a segue into our introductions to our speakers today. For the session, the participants that are joining us today are highlighted here. We have Clement Chow. He's going to be talking about N-acetyl L-leucine, which is also known as Tanganil for those that have been exploring this potentially for the last year, which is a product that was available in France and is now marketed within the US. It's FDA approved as Acnursa for neurodegenerative diseases. So last year, Clement gave us an overview of his drug screening protocol and identified NAL as a drug hit. He's going to be exploring that further this year, the work that he's been doing in addition to those studies this year. In our Syngap upregulation, last year we heard from transcript to bio. This year we're going to be in the identification of the drugs and the screening approach that they used. This year, we're going to be hearing from Chris Lee Messer in setting up a decentralized clinical trial to evaluate the effects of nortriptyline within our community. For the transcript restoration, I believe there was a scheduling change, and I believe Richard Novak already spoke today. And this was an approach from Unravel Biosciences, which was very recent, and it was through nasal swabs from individuals from Syngap-related disorders, so you did get to hear a bit about that. And for our rational drug selection, we were using Ravicti from the SLC6A1 community, and you're going to be hearing from Amber Freed from SLC61A1 Connect. She's the founder of that organization and a mom of individual with an NDD. And she's going to be discussing her experiences with drug repurposing. And then you're going to be hearing from Zach Grinspan, which also spoke at our last year's conference. And you're going to be hearing an update on the Ravicti clinical trial with Syngap-related disorder. So with that, I will stop my sharing and we can switch to the presenter